Welcome to the Toward a Healthy Built Environment Training for Health Professionals series. We're excited to be introducing Tannis Cheadle, a health system consultant. In this presentation, she will highlight some of the key resources that have been created by the health authorities and other stakeholders to support healthy built environment work.
And our intention in putting together this whole whack of resources, and we haven't shared them with you yet, but our plan is to make the resources or links to the resources available after the workshop. So it's coming your way. But we did want to walk you through the list of some of what we're providing and tell you a little bit about what they are. So our intention is to give you all of these resources, knowing that it's quite overwhelming, but there's probably a few in there that will really resonate with you, and some will resonate with some people and some will resonate with others, and there's probably a few that will be your go-to resources that you keep in your pocket and you carry everywhere, and there will probably be some that sit on the shelf. But we wanted to provide you with a whole bunch of them so that you can have some options. Included in that package of tools and templates that we send to you, there's also a series of 2-pagers that Interior Health produced that they use as handouts. Some of the topics include healthy built environment generally, reducing tobacco use, healthy communities initiative, and community nutrition. From Vancouver Coastal Health, there's a response letter regarding the Metro Van Food Systems Action Plan and 2 response letters regarding the Hastings Urban Farm. One is from VCH and one is to VCH. And Speak Up for Health is a resource that we talked about in October. This paper uses the Linkages Toolkit framework as a guide to provide a health perspective on key issues of North Van's draft OCP. And I just wanted to flag that this is actually the document that's aimed at the public rather than the municipality, so just so you know what you're looking at. And there's also some advocacy guidelines and resources. So it answers questions like, what is population health advocacy? What are the principles? Why is it important? And it provides a framework and resource links. And Claire's going to be speaking about that more tomorrow. From Island Health, there's a document called EHO Guidance Tool for Local Land Use Planning Reviews, and there's a really excellent appendix attached to that document that Jade uses as a response letter template, and then there's also 2 response letter samples that will be provided. There's a key messages cheat sheet, which I'm the facilitator, so I'm just going to hijack the agenda at the end of this and just speak a little bit about that. That's something that is fairly newly created and ever evolving. We're going to provide Pam's top 10 things to consider, a template for designing a community engagement process. So Stacey Barter from Plan H is going to be here tomorrow, and she's going to be providing that, and we're actually going to be using it in one of the exercises tomorrow. And then there's a whole range of Plan H fact sheets, and these are actually the content of them is on the Plan H site, and all I did was I copied and pasted them into a Word document. So they cover a whole range of topics like active transportation, healthy neighborhood design, healthy housing, clean air and water, climate action, public health, parks and green space, active living, healthy eating, and food security. But feel free to go to that website. It's a really excellent one if you haven't visited it. And then there's also a PDF document that they provide on that site called How Do Local Governments Improve Health and Community Well-Being? And then, of course, the larger resources that we were using yesterday, the toolkit, the Public Health Guide to Planning with Local Government, and the Healthy Rural Communities Toolkit. So just to speak to the key messages, and I'm calling it a cheat sheet. So what we will be providing is a 2-pager, and what I've heard from folks is working in this area and going to planning meetings and local government meetings is that sometimes they find themselves sitting in a meeting and the conversation's going on, and often these are folks who have relationships, they know each other. This might be the first time or the first couple of times that you've gone to a meeting and the conversation is happening and your head's spinning and you haven't jumped in yet and you're trying to figure out what to say and you don't know what to say, and I think this speaks to Pam's point about being as prepared as possible. But before you know it, the meeting's over and you haven't said anything, and then you're on the SkyTrain or you're walking or you're driving home and you're thinking, oh, man, why didn't I say anything? I should have said something. And so what this cheat sheet is intended to do is, if you like it, And again, it's just one of those options that you have. Take it, keep it in your back pocket, and it actually scripts out sentences that you can say if you're not sure what to say. So one of the first things that it suggests is that asking questions is always a good idea. So, for clarification, especially if you don't understand the way the conversation is going, so yay, you get to figure out what the heck is going on if you've asked the question, but actually the bonus is that people will know that you're listening, that you're interested in learning more. So you can never go wrong with asking questions. Citing the evidence, I've scripted some things here in this cheat sheet, offering your help in bringing a health lens. So people will think that you're helpful and aren't just there to criticize or tell them that they've missed something in their planning process. And so, sometimes it could be perceived that way. So head that off, get in front of it, figure out how to be helpful in terms of helping folks meet their agenda. The when to say it, I think Pam did a really good job of covering that. One of the things that I use is I force myself to say something every 10 minutes. Just say something every 10 minutes. I kind of use the same strategy on vacation, take a picture every hour, otherwise I go on vacation for a week and come back and have no pictures. But force yourself to jump in there every 10 minutes, and always, without necessarily being asked to provide your input, and I think Pam spoke to that as well. Nobody's going to turn to you necessarily and say, Tannis, what do you think? So just figure out a way to jump in there. The how to say it, I think also Pam did a really good job of speaking to that. One of the things that I will mention is the importance and the value of figuring out a way to tie agendas together. And one of the things that we found when we were developing the linkages toolkit was the great linkage to the sustainability agenda. And we haven't really talked about that, but that's something that we were considering when we were developing the toolkit. How do we also talk about sustainability and environmental health outcomes as well as physical, mental, and social health outcomes? And so, often the end goal is different, and so the sustainability agenda might be wanting to decrease CO2 emissions, and the health folks might want to be decreasing chronic disease. In the end, the path is the same one to achieve those two goals. And so, building on that example, you could say something like, active transportation infrastructure yields many additional community benefits, such as efficient transportation and improved air quality due to less vehicle travel, and reduced contributions to climate change and improved vibrancy and livability. And so just figuring out a way to tie those agendas together. And finally, I included a bit of a blurb at the end to just reassure you and remind you that you don't actually have to have all of the answers. But the important thing is to actually get into the conversation. And so on any given topic, bringing a health lens or being the health voice means that you're raising the issue and suggesting that it be considered as a priority for consideration by all. You can always go away and find more information and bring it back to a future meeting or with a follow-up phone call or email. And finally, I just wanted to leave you with one thought, and that is I think that saying something is always better than being silent. Even if you keep it at a very high level, you don't make any promises, but if you speak up, again, people are going to know that you're listening, they're pleased that you want to learn more and be engaged in their community process, and being silent, you run the risk that people will think the opposite, and potentially even worse, that they may not think that health is a concern. So just wanted to leave you with that thought of getting in there and saying something is better than not saying anything.